Sigmund Freud, the first talk therapy advocate in the psychological realm, believed in the unconscious mind and the id, the ego, the superego, as we talked about in the the personality chapter. Again, the conflicts that a person experiences, the source of their symptoms, he believed resided in the unconscious mind, and therefore psychoanalysis was insight-oriented. His primary goal was for he himself to gain access to the client's or patient's unconscious mind, identify the unresolved conflicts, those things that the person is still unable to deal with through ego refereeing between id and superego. And then he would, at the right time, in the right place, in the right way, reveal that unconscious conflict, suggest the solution, thus giving that client insight, which he believed himself was healing. Knowing the source of the problem and getting some ideas about how to undo that, he believed and found could help dramatically. In order to get at the unconscious mind, he had to go through various back doors. One was dream analysis. He believed that all dreams are fulfillment of wishes, that all dreams are coded unconscious conflict, and thus he worked to develop the code through a vast and detailed understanding of each individual person who came to see him. He took copious notes, wrote down almost everything that the patient said himself very little. He believed that the therapist's only job was to prompt and record, and every once in a while provide insight into issues. This is a mock-up of the original layout of Freud's therapy area. This is the couch, the therapist's couch, that the patient would lie down on, and Freud would sit out of their view somewhere. He believed that even seeing a therapist's facial expressions or body changes could impact the patient in a bad way, or in a way that would maybe cause them to shut down or attempt to give the therapist more of what they're looking for. So he wanted to be completely out of view of the patient. Nowadays, usually people sit upright, and therapist and client are sitting face to face, having a conversation. And it's been seen that the therapist's reaction to the client is important for the client to be able to see. It's a social interaction. It's a social relationship. No distancing required. Free association was another. You might have even played this game where somebody says a word and you say the first thing that pops into your mind. Freud believed that if you could get the person into the flow of free association, and then once the person is not filtering anymore, they're just going first impulse, he could drop the bomb words in, and that the unconscious would accidentally let slip great truths that have theretofore been unrevealed to the patient. So he would say the first thing that pops into your mind when I say the word tree. The person says squirrel. Therapist says leaf. Patient says fall. Therapist says water. Patient says swim. Therapist drops the bomb mom, mother, and hopefully the patient doesn't have time to register that. It doesn't filter his response or her response, and out pops the truth. Nagging and controlling. We'll stop here.